Hi, this is Dr. Nemechek of the Nemechek Protocol in Buckeye, Arizona. Want to do a quick little one on toe walking. And what is this? All right. So, a very common thing that you have in kids with or without autism, even kids with just developmental delay, or even kids who are just starting to get a little cumulative brain injury, is toe walking. So, what is that? And well, it has to do when we get injured in the head, all right? And remember, these injuries can be a physical thing. You know, you fall down, hit your head on the coffee table, little kids. It could be an emotional trauma. The dog dies. Daddy's gone for a week on a business trip, and the child thinks they're abandoned or something. We've seen that. Vaccines, surgeries, all these things can cause some brain injury. And commonly, you get kind of two things. One, I've talked about how the intestinal conveyor belt slows down, so kids get cramping and constipation. That's brain injury stuff, all right? But the other very common thing is they can't generate enough blood pressure up into their head when they're upright. Let's use this. They can't push the blood up to the top of their head, all right? And let's talk about this in the sense of this is ADD, and let's say a 7th grade kid. He's in class, he's sitting still, he has this damage, he can't get blood pressure up into his head, and what happens is the blood will pool down in the legs, in the muscles of the legs, all right? And the brain learns this, and the brain learns in that 7th grader to tap his feet, tap, 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 and wiggle them, okay? Now, most everybody has seen these people, like you go to a cafe, restaurant, and people are all engaged in conversation. They have a very nice time, and there's somebody there with their feet going, okay? Those people have very likely chronic damage to their autonomic nervous system. They can't regulate pressure of their head, and their subconscious brain is taking over and driving pressure to their head, okay? Because moving muscle drives pressure, gives you more oxygen, brain feels better, all right? Now, let's go down to little kids. So this is, say that 7th grader in class, he knows not to get up and move around because he'll get in trouble. Now, as he gets younger and younger and less mature and less kind of in control of these impulses he's feeling, he'll get up and move around. We call him hyperactive, all right? Now, what's that do? It's moving the leg muscles to generate blood pressure to give him more oxygen. So what's toe walking? Well, toe walking is just a permanent, it's like an isometric where you're like, you're permanent contraction of those muscles. You keep blood pressure to your head, okay? That's what they're doing. These poor kids have a little cumulative brain injury, and they've got some autonomic damage, which fortunately the Nemechek protocol will fix. Those of you who have traveled and you open up the magazine on the airplane, what do they tell you to do? These isometric to squeeze, your legs, put your legs out, pump them, flex. Why? Because it moves blood up to your head. These kids, that's all they're doing, okay? So toe walking is a kind of subconsciously driven process to help generate pressure in the brain so the kids get normal oxygen. It's from cumulative brain injury, which is happening to almost everybody, and it is, in these kids, it's easily reversible with the Nemechek protocol. So I hope that's a helpful little pointer for you. Otherwise, y'all have a great day. This is Dr. Nemechek, Nemechek Protocol, Buckeye, Arizona. Take care. Bye.